Knock, knock, knock. Hi, my name is Angela. Your name is Mr. Mellon. You were born on July 8th, 2000. Check, you got some new orders. I need to do a dressing change on you. I'm gonna step over to the side and wash my hands. And then I'm gonna put my clean gloves on. And I'm going to take off your old dressing. So then I'm going to put that in the trash. Then I'm going to take off my clean gloves. And then I'm going to wash my hands again. Then I'm going to open my sterile dressing kit. But before that, I want to put your mask on so that I don't introduce any bacteria to the area. Okay. So this kit is sterile. So I'm gonna get everything on the inside. So I'm gonna grab my mask. I'm gonna put that on. Now, I'm going to grab my sterile gloves, pinching from the inside. I'm going to drop those down over here. I'm going to get using my 1-inch border, placing my sterile mat. Now, I'm going to open my gloves. Okay. And we're going to grab the dressing. But first, are you allergic to any shellfish or iodine that you know of? The patient says that he is allergic to iodine, so we're going to use alcohol. So I'm going to discard that. I'm going to start with my first one from the inside out, rotating circularly out. And I'm going to use my last one to go away from the site. Okay, I'm going to measure and see that it's only 3 milliliters out from from the injected port site, so there's no deviation from the last measurements that were taken. So my site is all clean. Now I'm going to take I'm going to place this And I'm going to remove this sticker so that I can write the time, the date, and my initials. And then the dressing change is complete. I'm going to remove my sterile gloves and I'm going to clean up my mess. And then I'm going to wash my hands. Then I'm going to put on a pair of clean gloves. And we're going to do a blood draw. I'm going to do my blood draw from the proximal tube because it's going to have the cleanest blood in it. My medial tube, which is the blue tube, is used for more viscous medications such as chemotherapy. And then our brownish, which this one is orange, is used for things like lipids, if we want to get that into the patient. So I'm going to start by, this is sterile, so I've removed the hub. So I'm going to clean that area with an alcohol prep. Then I'm going to flush with normal saline. Always when you're flushing with normal saline in these tubes, you want to break it down a little bit to break the seal and then push it up to where you need it. I'm going to insert 10 milliliters of normal saline. Then I'm going to discard that. Then I'm going to draw my blood. My first blood, I'm going to draw 10 milliliters of blood out, and I'm going to discard that just in case there's any leftover heparin or it's just not clean blood and not wise to use. So your first 10 milliliters you're going to discard. Then I'm going to draw my sample, and let's say I dropped 10 milliliters of blood, and I've got that good. Then I'm immediately going to go over to my tube, and just so no hemolysis happens, make sure that I get direct contact. One of the things people don't know when they're inserting blood in these tubes, if you hear a psst sound, it's no good. So you're going to discard that and you're going to have to draw that again. So I've drawn my blood. So now I want to get another clean alcohol wipe. Wipe my port area again. And then recap. Okay. All right, Mr. Mellon, you've done a wonderful job today. If you have any questions, feel free to ask. And thank you for your participation.